All right. Okay, next we will have Dr. Hersh. Get my glasses on.
Good afternoon. Thank you for allowing me to testify in support of Senate Bill 212 and in support of the civil rights of transgender people. I am Dr. Eva Hersh. I'm a family physician. For the past 10 years, I've been the primary care physician for many transgender people, providing hormone treatment, pre-op care, post-op care, as well as general primary care. I've really enjoyed working with transgender patients, hearing their stories, and sharing their struggles. I've also been active in training physicians and other medical professionals in the medical management of these patients. My main purpose in being here is to be a resource for you and to answer any questions you may have about this condition and how it is medically managed. Working with underserved populations in Maryland for the past 25 years, I have come to understand the many obstacles that block the paths of people who are members of disenfranchised groups. The degree of discrimination that transgender people suffer is exceptionally severe. Prejudice against transgenders extends beyond discrimination in employment, housing, and public accommodations. Many people question the right of transgender individuals to exist at all. Like most prejudices, these attitudes grow out of ignorance and lack of understanding, but unfortunately, education is not enough to end discrimination. Discrimination, verbal abuse, and violence against transgenders will continue until society and the law make it clear that transgenders have the same rights as all other citizens and that their rights will be defended. The current thinking of medical researchers studying transgenderism is that it is a medical condition which is present at birth. Transgenderism is an intersex condition of the brain, as previous speakers have mentioned as well, in which the gender of the brain, the gender identity, is the opposite of the genetic sex. Like many congenital conditions, there is no cure for transgenderism. All types of attempts to change transgender people's feelings, thoughts, and minds to match their genetic sex have been unsuccessful. Fortunately, there is effective treatment consisting of hormones, gender transition, and sex reassignment surgery. Difficult as this treatment is, it has turned out to be a fact that it is easier to change the gender of the body than the gender of the mind. Our understanding of transgenderism today is not far above the understanding of epilepsy a couple of hundred years ago. At that time, people with seizures were thought to be possessed by devils. The treatment ranged from prayer to burning. Today, it's clear to us that those beliefs and attitudes were misguided and even cruel. As more evidence emerges that transgenderism is a medical condition, today's anti-transgender prejudice will be recognized as just as foolish and unkind as the past prejudice against epileptics.
Thank you very much, Doctor. Any questions, Dr. Hersh? No, thank you. That concludes the panel.